The following information is intended for educational purposes only. It is not medical advice. The views expressed do not reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.
If you have a great chiropractor and you visit them on a regular basis, great, keep going. You are doing something that most people don't even consider. But did you know that there are different types of chiropractors and different methods? Today we're going to explore a technique that doesn't just put joints back into place, but retrains the body to stop it from happening again. Today we're talking about the Gonstead chiropractic method with Dr. Rich Benjamin, and he's about to give you a health awakening. Welcome to the Health Awakening. I'm your host, Scott Laird. Do you go to the chiropractor on a regular basis like you would for a dental checkup? If not, you should. Your spine is the hub of mobility for your entire body, and correcting problems may be simpler than you think. And a very intriguing way to correct such things is with a Gonstead method chiropractor. What is that? Let's ask one. Dr. Rich Benjamin, welcome to the Health Awakening.
Thank you very much for having me.
So, Gonstead, we'll get into this in a minute, but
Sure.
Originally, so you're a chiropractor.
Yes.
And you had started off your college career wanting to be an MD.
Yes.
Okay, so how far in did you get into that before things changed, and what changed?
Really, for me, my mom is a psychiatric nurse practitioner, and my dad's dream was always to be an MD, but he wasn't able to do that. We're from Sri Lanka originally and emigrated to the United States when I was 12 in 1989. And, you know, his goal was always to have a doctor in the family. And that was like the pinnacle, you know, for us in my culture. It's doctor, lawyer, engineer, CPA, you know, they're tiers. So I really wanted to be an MD. You know, my dad didn't want me to go into the military and be a Navy SEAL, so this was the next best thing for me. I thought, okay, let's be a doctor. And I was always interested in that. Great grades in school, you know, honors in high school, honors in college, and I really thought that this was my path. My mom, working in a hospital, got me in there. And I got to see all these surgeries, and I thought it was fascinating. And, you know, what really changed my mind about it was the culture of the hospital. It's not like it's on TV. And there was such a disconnection between the doctors and the patients. You know, it was all about procedures, and I felt like patients were just being run through. And the biggest thing for me was nobody got well in the hospital. They stabilized. Where was this magical healing? You know, Dr. House didn't come in and be like, oh, it's this and now you're good. There was none of that. There was none of that miracle I was looking for, that, you know, that spark.
The TV show. Yeah.
There was none of that. It was it became very like run of the mill. It was just, there was no spark. No one was happy. No one's happy to go to a hospital. It's not a positive environment. You know, it's stressful. It's crisis care. And I just really felt strongly that this was not the place for me. And you know, in a dream, I felt like I heard the Lord tell me that this was not my path. And it was a very difficult thing to tell my parents that. You know, their golden boy, their golden child, you know, their honor student is not going to be a doctor. And it crushed them. I actually went to work for a collections agency when I graduated pre-med from St. John's University, and my dad, being my dad, couldn't stand to see his son languishing in corporate America, you know, brought me a brochure for chiropractic school, and I didn't want anything to do with it. I thought chiropractors were quacks, it was a sham, it's not really scientific, it was tantamount to witchcraft. But when I got to chiropractic school, my mind completely changed when I learned the truth.
So Dad had presented you with this brochure, and what made you finally decide, after saying it was quackery, go, okay, whatever, I'm going to do it?
It was to please him, because he could get me out of the house and I could make a decent living. Really was the impetus about that. I said, okay, let me try it. And the biggest thing is that the first 2 years of chiropractic school are exactly the same as medical school. So for me, if I did that, I knew I could transfer out if it wasn't the right fit for me. That I knew I would get the same training. I mean, anatomy and physiology and science doesn't change, right? We just specialize into two different branches where MDs work on drugs and surgery. We work on spinal correction to achieve health. So I thought, all right, this is a good fit. It's part of my training. I've already got the pre-education for it. Why not?
And you saw that, how far into school did you get when you decided, this might provide the happy ending that I didn't see in the hospital?
Well, at 22 years old in 2000 when I was in school, I had a severe rotator cuff injury that I thought was going to have to be operated on. I'd had 2 cortisone shots into my shoulder for it. I had really bad crackly knees from playing football and rugby and all these crazy contact sports. And I thought, my knees are going to be gone and I'm going to have knee replacements by the time I was 30 years old. And I really was losing the ability to sleep. Like I could sleep 3 hours and then I'd be up watching TV and then going to class and falling asleep because I'm exhausted. And you know what that does to your moods. I was just somber and I tried all kinds of things to help me sleep and nothing was working. And I was really getting frustrated with it. So it was until I found a Gonstead chiropractor off campus and went to his office, and it changed my life. After my first adjustment, I went home and slept for 16 hours.
Wow.
And I called him and I'm like, is this normal? Was I in a coma, And he's like, that's your body achieving health. You needed to rest. I mean, he fixed his shoulder and he fixed my knee pain. In one adjustment, I was able to squat all the way down, all the way up. I'm like, get out of here. And that's not for lack of trying. I mean, this was about 6 to 8 months into my education, and I had gone to all the gurus on campus, the upper cervical guys, the kinesiology guys, the muscle testing guys, the sports chiropractic guys. We have all that. But nothing facilitated the change like a Gonstead adjustment did. And it absolutely changed my life.
Had you gone to other chiropractors before this one?
Oh, tons, yes.
Okay.
Even before school, I had gone to a chiropractor for a car accident, and it was just a very generic, manipulation of everything, and then they put you on the therapies, right? And then once the lawyer said, okay, your time is up, I stopped, and I was like, well, what's the point of this? And I don't mean to be derogatory, but for me, for my personality, I wanted more.
I want to ask you more about Gonstead in just a minute. But right now, we're talking with Dr. Rich Benjamin about Gonstead Chiropractic. We'll have more from the Health Awakening in just a moment. Stay with us.
Clashing head-on with worshippers of the moon goddess Diana and with those who made their living selling likenesses of her, Paul is surrounded in Ephesus by a rioting mob, bent on protecting their pagan traditions and their livelihoods from the truth of the gospel. Our world today is no different.
And this is exactly what Paul is teaching. He's teaching the Gentiles to not forsake Moses, but forsake all of their paganism and come back to the truth. That is Israel's job. That has been Israel's job from the very beginning.
Trouble in Ephesus by Michael Rood offers a sobering parallel to modern times. Learn how we can use Paul's example to expose the distorted rituals of modern Christianity that distract from the prophecy-fulfilling truth of Yeshua's birth, death, and resurrection. You won't see this teaching anywhere else, and it's not for sale, but you can get it as a thank you from Michael Rood for your love gift donation of $50. Donate $100 or more, and you'll also receive this beautiful box of God's promises. Over 100 of the Bible's most encouraging promises, kept in a beautiful glass case, featuring a scene from the Jaffa Gate in Jerusalem. Or for a gift of $300 or more, you'll receive the teaching, the glass box of promises, and this solid wood and silver-plated challah bread cutting board. This exquisite showpiece features beautiful silver-plated artwork and even includes an engraved bread knife. Get this collection now, available in December only. It's a thank you gift from Michael Rood in appreciation of your support of A Rood Awakening International. You'll get the Trouble in Ephesus teaching for a love gift donation of $50, the teaching and the glass box of promises for a gift of $100 or more. Or get everything plus the solid wood and silver-plated breadboard for a love gift donation of $300 or more. Get these gifts now while supplies last. Donate by phone at 800-788-7887 or visit monthlylovegift.com.
Our whole motto is to get sick people well. It's not just feel good. It's actually come in with a problem, leave with a solution.
And welcome back to the Health Awakening. Before the break, we were talking with our guest, Dr. Rich Benjamin, about a Gonstead chiropractor, and you had your own experience with that. You had rotator cuff problems, you had knee problems, you tried every different chiropractor there was because you were in chiropractic school.
Yes.
What led you to a Gonstead chiropractor?
Well, I was kind of lamenting to a friend of mine, whining really, and I told him, I'm like, this chiropractic stuff is relief care. It's not fixing anything, Why spend my money and time chasing relief care? I could go to a doctor for that, for symptom care. I was like, I'm not healing. And he's like, you need to come check this guy out. His name is Dr. Mike Stewart, and he's a Gonstead chiropractor. And I'm like, whoa, what's Gonstead? We don't hear about that until we're way later on in school, because school's idea is to expose you to a lot of things. They call it a bag of tricks, and they want you to diversify. Well, to be diversified means to be non-specific, right? And I said, well, what is this Gonstead stuff? And he said, well, it's a system of meticulously analyzing the spine and deciding what steps to take to correct a patient. And I'm like, ooh, correction. I like that word. That means fixing, so I can move on with my life. And so we went to Dr. Mike's office, and he had a workshop for students at 7 o'clock on Mondays. And when he walked in the room, there was this sense that this man's confidence, he knew what he was talking about. And he would put up cases, Leah, like, what's this case doing in a chiropractic office? Asthma, ALS, MS, right? Just fibromyalgia and just all this crazy stuff. And I'm like, there's no way. We're told in school to refer out for all this stuff and let a real doctor handle it, right? And here he is putting up cases that you would see in any MD's office or any hospital any day. And I'm like, wow. And so I went up to him at the end of the class and I said, Doc, could you please check me? And he said, no. And it was the first time someone had ever said no, not just laid me down and cracked me up. And I'm like, what do you mean no? Aren't you going to take care of me? Don't you care? He's like, I do, but you don't have any x-rays with you, do you? I'm like, no. He's like, do you even know how your spine is moved, which we call a listing system, so we can specifically know when the vertebrae have moved? And I'm like, no, I have no idea. I said, tell you what, if you're serious, come back to my office, make an appointment, and come get checked. And so I did. I called his office, I went in, he took x-rays. He didn't say a word to me the entire time. And I thought, I'm not going to tell this guy what my problems are, right? And after he analyzed me, we used a scope that shows us where the nerve is impinged very specifically. He used that meter on me, and he goes, And I'm like, well, what does that mean? Do I have cancer? Like, come on, what's the deal, right? And then he puts his x-rays up, and he stared at it for about 2 minutes without saying a word. And he turns around to me, and he goes, you have bad knees. And I'm like, yeah. He goes, you also have a bum right shoulder. I'm like, yeah? And he's like, and you're not sleeping. And I'm like, how the heck did you figure that out?
How did he know that?
I mean, he saw it from his meter, from the palpation of where the inflammation is, the x-rays, and his experience. And I was blown away. And I'm like, that's exactly right. And so I went and laid down on the table and put my body like in a contorted position, thinking that's the adjustment I was going to get. He's like, oh no, big boy. You're going on this table down here. It was in a kneeling position. It was very strange. And then he walked over to me and he's like, just relax and we're gonna move this disc off of the nerve. And I'm like, my discs? Well, I thought you couldn't fix a herniated disc. He's like, no, that's exactly what a subluxation is. It's a disorder of the disc that is compressing a nerve, and only the soft tissue can compress a nerve, not the hard tissue. So we use the vertebra as a lever to move that disc. And that first adjustment, I felt like lightning go down my legs. And I thought I was paralyzed. I mean, the pain was unbelievable. And he adjusted my upper back, and you should have heard my spine made this crazy noise. But when I got up, he was smiling. And I'm like, what did you do? He's like, I just adjusted you. That's an adjustment. I had never felt anything like that. It was profound. And I'm like, oh man, that was crazy. I was sweating. He's like, squat. And I'm like, I haven't done that in a long time, doc, my knees. He's like, just stop whining and squat. And I squatted all the way down, all the way up, zero pain, no clicking my knees. It was incredible.
Wow.
Incredible.
So was this the point you decided, okay, I'm going for this type of chiropractic?
Yeah, and I kept going to his office and begging him to let me just follow him and watch what he did. And he didn't want me there. He's like, I'm busy, I got no time to babysit you. So I like cleaned his toilets, I vacuumed his office out. I showed up every day, after school, organized his charts, babysat his kids, mulched his lawn. And finally, when he knew he couldn't get rid of me, he's like, you're really serious about this? I'm like, yeah, I've never experienced anything like this. I want to know what you know. Because I knew that school wouldn't teach me that. You know, that's not the school's job. The school's job is to have you pass boards, get your diploma, and be safe to go out there and then specialize. But I wanted to learn this stuff now.
So you learned all that, and you became a Gonstead chiropractor.
Yes.
What are some of the craziest things you've seen in your office? You said you saw all these things with ALS and asthma and all these. What kind of things have you seen?
I've seen people be carried in and after an adjustment walk out on their own power. I've gone into a parking lot and adjusted a patient out of a seizure.
Wow.
I mean, I have a lady now that's, really suffering, and her diagnosis is epilepsy, and they said that she has brain damage, and she's on 6 or 7 different medications. And I'm like, well, if she has a physical problem, why are you using a chemical solution? So we analyze and see, well, here's where this is coming from. We can feel this inflammation. And so we've been adjusting her, and she's like, I'm just starting to not have migraines. My seizures are abating, I mean, I had a kid last year come in a wheelchair, and they say that he had Lyme's disease. That was the generic diagnosis. That kid is walking now and working out, getting his life back.
Wow.
23.
We're going to come back with more with Dr. Rich Benjamin. We're going to talk about Gonstead and all of the crazy things that you have not seen yet from this type of chiropractic. We'll be back with more from The Health Awakening.
The Chronological Gospels Bible is changing lives all over the world, putting everything the Messiah did in exact chronological order and explaining the behind-the-scenes truth of what the Messiah did, when he did it, and why. The timing of it all means everything. And now, the Chronological Gospels can be easier on your eyes. The larger print edition features 40% larger type, and every page appears exactly the same as the original, so you can follow along with others who have the regular size version. The Chronological Gospels larger print edition also has wider margins to write notes, and the premium quality paper means you can highlight without soaking through. Plus, the larger print edition lies flat, so you can teach without having to hold the book open. The Chronological Gospels larger print edition is a big and beautiful coffee table book, measuring a full 12 inches tall and 9 inches wide. Study the Bible with clarity and ease.
I love the size of this book. This is 9 by 12. The paper is perfect because it doesn't bleed through when I write on it. I can mark it up, and I always make notes in all my Bibles. Everything is the same place as it is on the smaller version, and I can just stand back and I can teach from it, and it's the perfect size. I pray thee, of whom speaks this prophet?
Order the Chronological Gospels larger print edition by phone or online. You'll get 40% larger type than the original. Call 800-788-7887. That's 800-788-7887. Or get the Chronological Gospels Bible larger print edition online at aroodawakening.tv/large.
And welcome back to The Health Awakening. Before the break, we were talking with our guest, Dr. Rich Benjamin, about correcting problems, physical problems, not by using chemicals, but a physical solution. And more specifically, we're talking about the Gonstead method. Now, we were talking about how you've seen people with epilepsy and, kids or people with Lyme's disease and things like this come into the office and then leave, and they don't have these things anymore. So now, most chiropractors will take an X-ray and things like this. And
yes.
So what is so different about Gonstead?
Dr. Gonstead figured out back he started his practice in 1923, and over the years he figured out how to just analyze the spine and engineer how an engineer would a building, right down to degrees and millimeter, and really figure out where the nerve compression is. And then using that information to deliver a specific correction. It's not a random manipulation. We're not just trying to get the vertebra to move. We're actually trying to correct it and put it back into place. And I think that's what makes it so effective, because it's specific. And if you're specific, you can be scientific, right? The first chiropractic adjustment was not for pain relief. Dr. D.D. Palmer in 1895 found a vertebra out of place at T7 on Harvey Lillard and realized if he put this back into its correct position, it would help him. And he didn't really know that it would restore the man's hearing.
His hearing?
His hearing.
This had nothing to do with pain.
Nothing to do with pain whatsoever. And his hearing got restored. And so that's where chiropractic was born. It was born about restoring function. So the way that the human body was designed, it was designed to work without interference. And all my job is to move that interference out of the way. And the body will heal itself. It will heal itself.
Now, when people get a diagnosis that sounds very downhill, like when someone's told, I know this is a very generic term, but spinal degeneration.
Sure. Or spinal stenosis is a new
Spinal
one.
stenosis. So is this kind of thing reversible with
Absolutely,
Gonstead?
yes.
Okay.
Yes, now that's not the objective, but we do see that happen all the time. Very interestingly so. And the more people come, and I know that's one of the things people say, oh, once you go, you gotta always go, but they never say that about their teeth, right? Well, why do you brush your teeth every day? Well, you wanna maintain them to stay in your head, right? Well, your spine is infinitely more important. It's the housing system for your nervous system. Well, how important is that? Right? A dime's weight of pressure on the nerve will decrease that nerve output by up to 60%. So shouldn't you want to maintain that and make sure that's not impeded? Because if that nerve was going to your heart, what's going to happen to your heart? And a lot of times that's undetectable. So you hear stories of people dying of heart attacks who are marathon runners or triathletes, right? Supposedly healthy people, but are they getting their nervous system checked? Right?
That's very interesting. You know, because we always talk about diet and exercise and all these things, and I was going to ask you that if people could literally have heart attacks and things of this nature just because of a pinch in their back.
Well, food doesn't cause inflammation, and food, you know, it doesn't cause the damage. Food will only exacerbate or diminish inflammation, but it's not going to fix the cause of that inflammation. The cause of inflammation in our bodies is trauma, whether it's physical, chemical, or emotional, right? How can food fix that? So it can help,
right?
And it does.
So going to a chiropractor on a regular basis is like going to get your oil changed in your car. Just because there's nothing, you don't hear anything wrong with your car, just because you don't have a pain, doesn't mean you don't have to go to the mechanic.
Correct. Any repetitive motion over time will break down our joints. That is scientific fact.
And that doesn't mean just athletes. That can be repetitive motion as in sitting at a desk, right?
Computer work, truck drivers, pilots, doesn't matter. Astronauts, and they're in zero gravity.
Wow.
Yeah.
Now, if someone is leery of going to a chiropractor, they say, oh, you know, I don't want anybody touching my neck, and I'm kind of scared of that because I've heard of strokes happening and this kind of thing.
That's a 1 in 12 million chance.
Okay.
You'd have a greater chance of being eaten by a great white shark.
Wow.
Like, it's so safe, they think I'm more dangerous in my car than they do in my office. That's how little we pay for malpractice. I mean, really, and the Gonstead system especially, Dr. Gonstead did not like the way people were manipulating necks. So he came up with a system to where we adjust the patient in the chair so it moves forward. The nose never breaks the midline. The nose is always in the center. So I've adjusted people that have had active strokes in their temporal arteries or a 90% blockage in their carotid artery, and one of them was an MD. Can you imagine if I killed an MD? Right? That would be all over the headlines. So it's so safe. We adjust babies with just a little push with light pressure. You know, we are clinicians. We're not technicians. And so you have to use your knowledge, your experience, and the beautiful thing about Gonstead is that it really prepares a practitioner once they get out to serve the public to do the best job they can for them.
You were saying that when you first went into chiropractic school for medical, it reminded you of medical because it was a lot more, I don't want to say scientific, but what was the difference there between regular chiropractic? You said it was a lot more clinical based?
With the Gonstead, like every chiropractor learns what medical students learn in their first 2 years, right? But but Gonstead took it one step further. You know, he just took it to that point where we have to be specific and intent and have an intent with our care to move that patient to correction. And I think that's what makes it very much like what doctors want to do. They want to fix your problem. Well, we want to do the same thing, but we want to do it naturally and non-invasively and very safely. And if you look at the statistics and if you do the research, and I'm not trying to put anyone down, but it's a lot more dangerous to take medication and have surgery than it is to have a chiropractic adjustment, by far.
So a Gonstead chiropractor will look at the symptoms, but then try and get to the root of the symptoms, not just treat them.
All chiropractors do that too, but we just have to do it in a very specific way to try to get the patient as well as fast as possible.
All right, well, we were talking with Dr. Rich Benjamin about the Gonstead chiropractic method. Stay with us, we'll be right back with more from The Health Awakening.
As he ministers in Ephesus, the Apostle Paul finds himself surrounded by a rioting mob, bent on protecting their pagan traditions. Our world today is no different.
And this is exactly what Paul is teaching. He's teaching the Gentiles to not forsake Moses, but forsake all of their paganism and come back to the truth. That is Israel's job. That has been Israel's job from the very beginning.
Trouble in Ephesus by Michael Rood offers a sobering parallel to the pagan traditions of modern Christianity. Get this teaching as a thank you from Michael Rood when you give a love gift donation of $50. Donate $100 or more and you'll also receive over 100 of the Bible's most encouraging promises, kept in a beautiful glass case. Or for a gift of $300 or more, you'll receive it all, plus a solid wood and silver-plated challah bread cutting board with an engraved bread knife. Get these gifts now while supplies last. Donate by phone or visit monthlylovegift.com.
And welcome back to the Health Awakening. Before the break, we were talking with our guest, Dr. Rich Benjamin, about the Gonstead method of chiropractic. And if people want to get a hold of you, how do they do that?
You can call my office at 803-547-9977, or you can go to GonsteadChiropracticCenter.com and look for us there. If you want to find a Gonstead chiropractor in your area, which I would urge you to, you can go to Gonstead.com and go to their referral directory, or also GonsteadSeminar.com and look at their referral directory as well. And you can always contact me and or my staff will be happy to find somebody for you. That's what you do.
All right. Dr. Benjamin, thank you very much.
Thank you so much. I really appreciate you.
All right. Our guest today has been Dr. Rich Benjamin of the Gonstead Chiropractic Center. You can watch the replay of this episode and get our complete show archive at healthawakening.tv. And for more information about Dr. Rich Benjamin and his practice, visit healthawakening.tv/Gonstead, in addition to the URLs that he provided for us. Thanks again for joining us. We'll see you next time for another Health Awakening. Thank you for joining us today on The Health Awakening. You can catch the replay of this episode and see our complete show archive at healthawakening.tv. For more information about our guests today and all they have to offer, please visit their website on the bottom of your screen. And please remember, the information you saw today is intended for educational purposes only. It is not medical advice, nor do the views expressed reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.